We know where you're at right now. We know how difficult it can be to be the son or daughter. The sandwich generation is a real thing. Being stuck between your aging parents and your growing children. This is some of the things we're going to be talking about today in our video. Hi, my name is Steve Cohn. I'm with Medical Consulting and Management. Many people don't always consider the cost of care. They're very good about talking about the price of care, but not necessarily the cost of care. So the first thing is one-to-one care versus care in a facility. There's really no comparison to one-on-one care versus getting care in a facility. Because if you think about it, it's all about the numbers. You will never get any better care than having one person by your loved one's side at all times, taking care of them. You can't get that in a facility unless you hire someone privately to be with that person. Ironically, in many situations, we are hired by families to be that private duty caregiver inside of a facility. So folks are actually having to pay twice as much because they have a facility that they're in, but they're not receiving the one-to-one care that they need, so they need to hire us to do so. Most facilities have a ratio of caregivers to clients or patients, and that ratio varies depending on how well staffed these facilities are. Lately, in the post-COVID era, I would call it, these facilities are very poorly staffed in a lot of cases. I'm not going to say that across the board, but many of them have so few staff that we walk into facilities and we hear bells ringing for people looking for assistance, and they are not taken care of for several minutes, sometimes hours, before someone comes around to take care of them. You're not going to have that situation if you have a one-on-one caregiver. And that's one of the benefits of hiring a professional home care agency, because you'll get that one-on-one attention that you just can't get anywhere else. In addition to the actual cost to hire someone to provide care for you, there's all kinds of other hidden costs that you may not even think about when it comes to the true cost of care. So if you think about this for a minute, as sons and daughters or nephews, nieces, whoever you are that are taking care of an elderly loved one, you are living your life. You're trying to coordinate the schedule of that elderly person, whether it's doctor appointments, whether it is making sure that you get them to and from appointments, making sure that they have enough food in the house to eat, errands, running errands for them, running around town, making sure that you get all the things done that are necessary. And what that does is it takes you out of your own life and puts you fully into the life of your loved one. And that is a true cost. You're not going to get paid for that unless you have some sort of an arrangement with your family where they're going to pay you, which does happen sometimes. I've seen that before. But most of the time, it's a loved one, a daughter, a son, who literally are just sacrificing their day, their life, their own kids. They're missing activities. They're missing that concert at night for their daughter or their son to go and make sure mom is taken care of. Make sure mom gets showered. Make sure mom gets changed before you put her to bed. Make sure she gets her dinner. All these things, when they fall squarely on your shoulders, that's a true cost of care for your loved one that most people don't even take into account. Our job as a home care agency is to try to give you back your life as either the son, the daughter, the niece, the nephew, so that you can live your life and still enjoy the life of your loved one who we are taking care of on your behalf. That's one of the true benefits of hiring a professional home care agency like MCM. Other cost factors to consider are things that you may not really think about, such as your marriage. I can't tell you how many times I've seen marriages strained over the care that needs to be given to a loved one. I've seen daughters pulled away from marriages to go take care of their mother, for example, and that creates quite a bit of problem at home. I've seen marriages break up, unfortunately. These are the true costs of the care that we haven't really thought about a lot of times when we just dive right in because it's our mom, it's our dad. We want to make sure they get the best care possible. But you have to look at the full picture. Now that we've talked about some of the actual costs, of care, let's talk about the logistics involved with true paying for care. And what I mean by that is, how do you find the money to pay for care, which can be expensive if you're dealing with one-on-one care, especially if it's like 24-hour care, 7 days a week. There are many different options available to find funds that will help you pay for care. One of them is what's called long-term care insurance that your loved ones may have purchased at a time when they were working, maybe 20, 30 years ago. Long-term care insurance is set aside. It's a special insurance designed specifically for the purpose of home care, or in some cases for the cost of assisted living. But long-term care insurance is what a good percentage of our clients use to help pay for the care that we offer. Another source of payment for care is if you happen to be a veteran. The Veterans Administration sets aside something called aid and attendance benefit money. It's sort of a pool of money that's put aside just for those who've served our country. And based on your level of service, that will determine the percentage or how much money you will be granted to be able to use for the care that you need. In some cases, that money can be used to put things in your home, such as like a chairlift, bars in the shower, things like that. So the VA is very good at helping their veterans pay for care in the home. Other things to think about, when families start to actually run out of money, they oftentimes will look at their home, the home that they live in, which in some cases is paid for. So there's no mortgage on the home. I'll give you a quick example. What my wife and I did with her mother was when she was heading towards the end of her life in her 90s, she wanted to stay in her home. That was one of her wishes. Her true wishes was to always remain in her home. My wife, Andrea, decided that she was going to honor that wish. So we hired caregivers ourselves. We knew that she couldn't afford it herself, but we knew that eventually when she passed, we'd be able to sell her house and pay ourselves back. So because we had a home care agency, we paid for the caregivers ourselves. You don't have to have a home care agency to do this, but you could pay for the care yourself and then get paid back after the estate settles and get paid for the care that you had already paid for your mother to begin with before she passed. So that's one way to do it. There's also reverse mortgages. There's financing against your home. There's different types of creative financing that can be done. You can use life insurance policies. Policies like life insurance can be used to pay for care in a lot of different ways. These are things you want to talk to your financial advisors about, but there are many ways to pay for care that people just haven't thought of all the time. And those are just a couple. How long would you like to wait before you get care for your loved one? Do you think there's any cost involved with waiting? Well, I'm here to tell you that there truly is, because the longer you wait, the quicker the decline begins in your loved one. And the quicker you get care, the longer your loved one's life will be. And I've seen that based on my own experience, watching people who we thought were headed towards end of life, but because they got care from MCM, the caregivers came in, took great care of them, and then 8, 10, 12, 13 years later, they're still alive, which is just the most amazing thing. They're able to enjoy their families, enjoy their loved ones. This is the true cost of waiting. If you wait too long, you won't have that opportunity. You won't have the chance to get professional caregivers in your home to take care of your loved one, to lengthen and improve their quality of life to the maximum level possible. So that's what we're talking about today. And we appreciate the fact that you have taken the time to really think this through. If you'd like more information about working with MCM and getting a professional caregiver to work with your loved one, check out our website below. We'll be happy to get back in touch with you as soon as possible.